Hi, I'm Victoria. I'm a general dentist working and living in Dubai. I work in a practice called Park Avenue Dental Clinic in Motor City, and I'm a new mum to baby Ruby, who's just having a nap here. I've been asked by Mother Tongue to answer a few questions about teeth. So cleaning our baby's teeth is just like cleaning our teeth. We should be doing it morning and night. If you clean your teeth more often than that, great. You can do your baby's teeth more often than that. It's good to get them in the habit of cleaning morning and evening, even when they're really tiny. We usually start brushing their teeth when their teeth come in. When they've got baby teeth, that's when we clean them. Unfortunately, most of the baby teeth cause pain when they erupt. Some babies are absolutely fine with it, but others suffer quite a lot. Often the primary molars that come through around the age of 2, they can cause quite a bit of discomfort because they're quite big. And that's just them breaking through the gum with a larger surface area. So yeah, it can be a little bit more painful with the primary molars. It is true, but it's extremely rare. They're called natal teeth, and usually they're very weak and they will actually fall out much earlier than a normal primary central. So yes, it does happen, but it's very, very, very rare. I've never seen it. So again, a bit like the when do teeth come in question, teeth start falling out around the age of 6. Sometimes it's earlier, sometimes it's later. I have seen children that their baby teeth haven't fallen out until they're about 8 or 9. So it's very normal to have quite a big variation in this, but on average it's around 6 years old, and it's the lower central incisors that usually go first. Around the same time, just to bear in mind, we get our 6-year molars in, which is our first adult molars, and they don't require a baby tooth to fall out in front of them. They come in behind the last baby molar. So it's just important around that age to make sure that your kids are brushing their teeth right to the back as these 6s come in, and we have these teeth for the rest of our lives, hopefully, and it's very important to take care of them. So teething can be really painful for not only for babies but for mums too. We do recommend chilled teething rings, not frozen but chilled teething rings or gloves. You can also get these little things that you put frozen fruit in, which really help. Just make sure they've started to defrost a little bit because we don't want them too cold. What else? Unsweetened teething rusks or teething biscuits can help as well. We can also massage the gums with our fingers just to help it. There is Bonjela, which is the numbing gel, which you can put on if they seem really disrupted. And if totally necessary, you can give them paracetamol for the pain relief if it's really out of control. So as I mentioned earlier, from the age of 18 months old, we just need toothpaste with around 1,000 parts per million fluoride. As they get a bit older, from around 3 years old, that can increase to 1,500 parts per million of fluoride. There's no particular brand that I suggest. I always say whatever's on special, just as long as there's fluoride content in there. Toothbrush wise, a soft toothbrush and an age appropriate toothbrush. Kids sometimes like the themed toothbrushes, so as long as they're enjoying it, that's important. We just want them to get using it and brushing their teeth. So signs of teething other than the teeth coming in are obviously irritability. I'm sure everyone has experienced this that has experienced teething babies. lots of crying, lack of sleep, lack of appetite, excessive drooling is a big sign, and they like to suck on things. So if they're a thumb sucker, they'll try and suck the thumb. They'll be more soothed by a dummy, and they're trying to chew things sometimes. So chew their hands, pick up things and chew them as well. They may get slightly rosy cheeks, and they may get a little bit of a rash, but that's usually due to the drooling, a rash around their mouth. And you may notice that their gums are a little bit swollen as well. So that's nothing to worry about, the swollen gums, it's just the teeth breaking through. Usually once the teeth are broken through, the pain sort of eases. It's not painful the whole time that the tooth comes up, but sometimes it lasts a little bit longer. And also bear in mind that it's just not one tooth at a time. It'll be the two lower central incisors coming through around the same time. So it may extend that period of irritability. So in an ideal world, our babies wouldn't suck their thumbs or have dummies, but it's very normal for them to have it. It's a soothing habit, and so we have to try and pick probably the best one. It is much easier to stop the dummy sucking habit than it is to stop the thumb sucking habit, because you can take the dummy away. So in that sense, that's why we would prefer a dummy over thumb sucker. So as we mentioned, it's highly recommended to brush the baby teeth morning and evening, or your kids' teeth morning and evening. You can also start flossing their teeth from around the age of 2 years old, particularly in between the primary molars. It's normal for baby teeth to have quite large gaps between the anterior teeth, the front teeth, but if they are tightly packed together, then flossing is really important, as food and bacteria will get trapped in between the teeth, and that's where cavities like to start. So introducing flossing in between the teeth not only is a great habit former, but it's going to help remove all the bacteria in their mouth and make sure that they don't get cavities. Thumb sucking can also do a bit more damage in terms of shaping the palate, making the arch of the palate a little bit too high, and also the protrusion of the front teeth. It's something that's very hard to correct orthodontically and can create something called an anterior open bite. So we try to avoid it if we can, or try and cut the habit as soon as possible, because obviously the longer they do it, the more damage that can be done. So yeah, try to stick to a dummy if you can, or transition them from thumb sucking to a dummy if possible. Lots of people are worried that perhaps they're not brushing their baby's teeth properly. All we want to do is remove the food debris, and just also take note that breast milk does contain sugar. So even if you're just breastfeeding and they've got teeth, it's important to give the teeth a little wipe down. Now, you can use a damp face cloth if you don't want to use a toothbrush just yet. If you feel like they're too small to start with a toothbrush, that's fine. You can get the silicone toothbrushes that you put on your finger, and you use them to brush their teeth. Or you can just start with a baby toothbrush that is the right age appropriate selection. It is good to get them used to having a toothbrush in their mouth and using a toothbrush. When they're very small, you only need to brush it with water just to make sure the debris is coming off. Once they're a little bit older, around 18 months, you can start using a small amount of fluoridated toothpaste. And for babies and children, we ask for around 1,000 parts per million of fluoride, which should be on the label of the toothpaste. It should be indicated there. If you have slightly older children, it's sometimes fun and also very educational to use something called a disclosing tablet, which is like a pink tablet that they suck on before they brush their teeth. And what it does is it highlights where the plaque is, and then once they've brushed, they can see where they've missed with the pink tablet. It still will remain pink if they haven't brushed off the plaque and the food debris. So That's a really useful tip for slightly older kids that are brushing their teeth themselves, maybe like 4, 5, 6 years old. You can start to introduce that maybe once a month and just make sure that they're actually brushing their teeth properly. So in short, yes, breastfeeding can cause tooth decay. Breast milk contains a lot of sugars, and we need to remember that that needs to be removed from our baby's teeth. So that's why as soon as teeth come in, we start brushing them, regardless of whether they're on solid food or not. It is also advised to actually wipe your baby's gums before the teeth come in, because obviously we're breastfeeding them, or they're having formula or breast milk in whichever form when they don't have teeth. So the sugar is settling on their gums. So to create a healthy bacterial environment in their mouth from the get-go, we do advise just to wipe the baby's mouth with a damp cloth and wipe their tongue down, maybe at bath time when you can remember to do it. Just once a day for that is fine. But it is important to start sort of cleaning their mouth from as young as possible. Obviously, sugary foods should be avoided, and sugary drinks, but be aware of the sugar content of seemingly healthy snacks. It's also important to note that sticky foods can cause problems, such as peanut butter or raisins or dates, because they get stuck in the fissures and grooves of the teeth, and they're very hard to clean out. Another notoriously bad food for causing cavities are popcorn kernels. The kernels just get stuck in between the teeth and we can't get them out. I often will find popcorn kernels that have been there for about 2 weeks. They can cause cavities if they're in there for too long, or they can just cause inflammation and pain of the gums in between the teeth. So just be aware of that. Although it's delicious, it can cause problems. So primary teeth usually come in between 6 to 10 months, and it's usually the lower incisors that start to come in first. It's very normal for there to be quite a lot of variation in this timing. Anything longer than perhaps a year out of the usual timing is considered abnormal. And if the babies don't have any teeth by 18 months, then we have to look further into it. But it is completely normal for baby teeth to come in a bit earlier or a bit later. If they come in a bit earlier, there's no harm. It just means it's a bit harder to breastfeed if you're breastfeeding. And if they come in later, again, there's no issues. It's just we need to adapt and be aware when we're feeding them and what they can and can't eat, really, in terms of solid food. And just one final note on creating a healthy sort of mouth. If you have yourself a lot of cavities or a lot of issues with your teeth, it is important that you don't share too many things with your baby, because bacteria from your mouth can be transferred into their mouth. So for example, if you lick a spoon and you then give it to them to use, or if you suck on their dummy before you put it in their mouth, the best advice would be to make sure that your own teeth are in great condition, to go to your dentist and get a regular checkups, and make sure there are no cavities that need to be addressed, because then in that way we can keep the bacteria in your mouth under control and therefore not pass it on to your babies. But if you are having a lot of issues with your mouth at the time, just be aware that you can actually transfer the bacteria from your mouth into your baby's mouth. So just be a little bit careful with sharing things or licking things or whatever it may be before you give it to them.